everybody, I am Diya Sharma and the topic for today is euthanasia and suicide. Many of us may or may not be aware of these terms. So, to start with, the term euthanasia has been derived from the Greek word euthanthos, where eu means well or good and thanthos means death. Thus, euthanasia means easy death. In simple words, euthanasia is the practice of intentionally ending a life to relieve pain and suffering. Different definitions have been given in different dictionaries and by different committees. A similar concept to this is assisted suicide, which means committing suicide with the help of some other person, often a physician. The term is interchangeably used with physician-assisted suicide. And now, the question is, what is suicide? Taking one's own life intentionally through various methods like pesticide, poisoning, firearms, hanging or any other means is termed as suicide. All the three terms sound similar but yet are different and are controversial matters. Now, for the better understanding of euthanasia, it is important to know the various types of euthanasia, which are: first, voluntary, where the consent of the patient is involved. Second, non-voluntary, is without the approval or consent of the patient. For example, child euthanasia. Now third, is involuntary. This is completely against the patient's will. Further, all these three types of euthanasia can be segregated into two: passive euthanasia and active euthanasia. Passive euthanasia involves discontinuing or withholding the treatment that was necessary to continue the life, while active euthanasia involves use of lethal forces such as lethal injections to end the life. Now the question arises, what is the difference between euthanasia and suicide? So the first difference is suicide involves ending one's own life, whereas euthanasia involves ending another person's life. Second difference is suicide is always voluntary in nature, whereas euthanasia can be voluntary, involuntary or non-voluntary in nature, as we have already discussed. The third difference is reason behind committing suicide can be hopelessness or despair, but euthanasia is an act of ending the pain of a patient suffering from critical conditions. Fourth, suicide is illegal throughout the globe, whereas the legal status of euthanasia is different in different countries. Let us discuss the legal status of euthanasia further. Netherlands was the first country to legalize euthanasia in 2002, followed by Belgium being the second. The other countries where euthanasia is legal are Colombia, Luxembourg, Canada. In United Kingdoms it is illegal, whereas in March 2018, passive euthanasia became legal in India provided strict guidelines are followed. Euthanasia is illegal throughout the United States except that assisted suicide is legal in 5 states of US. Euthanasia being one of the most controversial topics, so there are different viewpoints on euthanasia. So let us discuss. Firstly, we will discuss the supporters' views, then the opponents' views, and finally the religious view on euthanasia. As per the supporters, euthanasia will act as an insurance policy and that will make sure that no human dies with pain or unrelieving sufferings. As per them, there are 3 main benefits of legalization of euthanasia. First, realizing the individual autonomy. Second, reducing the needless pain and sufferings. Now the third, providing psychological benefit or psychological reassurance to the dying patient that I and only I have the right to choose to live or to die. On the contrary, the opponents argue that the doctor-patient relationship will be seriously weakened if societies legalize euthanasia, and there is a minimal possibility that a dying patient may be able to make a rational decision. Further, they argue that the more proper use of public funds should be made by making sure that all the patients who are near death have access to the palliative treatment, rather than spending money on setting up the procedural and legislative frameworks requisite for safe provision of euthanasia. Now, coming on to the religious view, there are a number of religions in the world, and every religion has its own set and principles. Therefore, it is equally important to know the religious view on euthanasia. To cut the long story short, most of the religions disapprove euthanasia. The Roman Catholic Church is one of the most important and active organizations in disapproving or opposing euthanasia. Religions are against euthanasia due to certain reasons like, first, they believe in a supreme God who commands that you must not kill. Second, they believe carrying out murder or suicide would be attack on the sovereignty of the God and would be against the God's orders. Third, they believe human lives are special and should be protected and preserved whatever way so happens. So as to conclude, most of the religions forbid euthanasia on similar grounds. And now moving on to the other part of our topic, that is suicide. The first question that comes to our mind after listening to this word is, why do people commit suicide? What are the risk factors associated to suicide? Before I pinpoint these factors, the question arises, what is the meaning of risk factors? Risk factors are basically the issues in a person's life that increase the probability or risk of them acting on suicidal thoughts. Some of the common risk factors are, first, history of mental illness like depression, anxiety, etc. Second, relationship problems like conflicts with parents or romantic partners. Third, history of substance abuse and previous suicidal attempts are common in nature. Others can be, first, legal or disciplinary problems. Second, access to harmful means such as weapons or medications. Third, the death of a family member or a close friend. Fourth, physical illness or disability, etc. The risk of suicide increases when a person has more challenges in their life. If a person is experiencing risk factors, it does not necessarily mean a person will attempt or think about suicide. Every person has different ways of coping up with the challenges. There are a number of protective factors that can claim to be of great help to reduce the suicidal behavior. It has been observed that strong family relations and connections helps in balancing out the negative or difficult issues in life. Though suicide is illegal throughout the world, still suicide exists in every religious group, every country and every age group. Suicidal behavior has different meaning in different cultures and is determined differently everywhere. For example, when a Buddhist monk self-sacrifices for religious reasons, it is viewed as an honorable act. Japanese have a mixed attitude towards suicide. Some approve and even glorify suicide when done for a good reason for controlling one's own destiny. The Hindu culture condones suicide for a great misfortune or incurable disease, but still customs of sati was practiced in India. The Pacific region, suicide is a culturally recognized response to domestic violence. Where in Chinese culture, women with no children can display their devotion towards their husbands through suicide upon their husband's death. Asian culture accepts the practice of suicide as a permissible in the context of interpersonal conflicts, familial shame, or unselfish reasons. If a person feels his behavior will bring dishonor to the family, they might consider suicide as the legitimate option. So, it can be clearly assumed that suicide rate is influenced by the society's perception of suicide and its cultural traditions. Stronger suicidal stigma against suicide believed to be protective from suicide, while weaker stigma may increase the suicidal rates. To put it in a nutshell, there is a complete conceptual difference between euthanasia and suicide. And the factors that lead to such decisions and actions are completely different. Euthanasia is termed as mercy killing to free the person from his absolute incurable disease, whereas suicide is a result of reasons like discrimination, love heartbreak, drug abuse, etc. There is no legal, law or ethical standards which states that gravely burdensome, ineffective measures to be used to keep a dying patient alive. Euthanasia can be a way to uphold the right to life by glorifying the right to die with dignity. A legal right to perform assisted suicide should be restricted to certain persons, specifically medical doctors. We can conclude that passive euthanasia exists in many states. As per our understanding, passive euthanasia and assisted suicide should be legalized and approved exclusively for terminally ill patients. Thank you.